See. So we're going to stick with that idea of the we, the big idea of the we, as we talk about our transformation as a department to a Department of Family Medicine and Community Health. And I do want to acknowledge my co-director of the Office of Community Health, Kirsten Reinflesch. She's in the Physician Development Leadership Program today, so she couldn't be with us, but this is kind of our shared ideas and shared contributions as we move forward. So I'm going to start here on the idea of partnering with communities. And I want to thank Angela Black, who's a research fellow in our department, for being the one to share this with me. It's a quote from a woman named Lila Watson, and she's a native Australian woman who is involved in Aboriginal rights. And she said, "If you have come to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then let us work together." And I think this idea is really important as we think about community health and what do we want to do with community health. It's very easy to say, we want to help those people. We want to do this. We want to fix their problems. And I think it's really important for us to be present about who we are and our presence and contributions in community and recognize that we're part of where we live. And that what we really want to do when we're approaching community health is be partners and co-creators and collaborators. And that's a vision that we want to bring forward. So I would like you to take a minute and use your notebooks and just jot down for yourself, who is your community? So take a minute and make a little list. Okay, so you can keep going and think of more, or you can stop where you're at. The next thing I'd like you to write down is what is one way that your community, and if you have more than one listed, you can pick that community. What is one way that your community supports your physical, mental, emotional, or spiritual health? Okay, so I'm asking you to find a neighbor. It can be the person you've been talking with for much of the day, or you can find someone maybe at your table who you haven't had a chance to talk with yet. And just take a minute each to share who's your community and what's one thing that your community does to help support your health. All right, so let's all come back together and just really quickly, a one-word answer. Can a couple people shout out, how do you define your community? Your family? Other people? Friends? Coworkers? Okay. Neighbors? Yep, lots of different ways. So we're defining community in our Office of Community Health with a definition that was developed by Kathleen McQueen. She did qualitative research with communities around the country when they were preparing HIV treatment trials and wanted to understand how do different communities define community? What does that mean? And the definition that came out of that research is a group of people with diverse characteristics who are linked by social ties, share common perspectives, and engage in joint action in geographical locations or settings. So I think it's important to note the location piece of it. A lot of times we think about where we're located at, but it could be based on other things that you have in common. And in this definition, what's really important is the joint action. So the community is defined by doing something together. For our Office of Community Health, we're using that definition of community and talking about the study and improvement of health in communities. So why community health? Why now? We've changed our name as of July 1st, and in some ways, this is a long history. The renaming of our department, in some ways, is not something new. It more accurately represents what we've been doing since the department was started 45 years ago. But in other ways, it does embody where we hope to go and how we hope to take care of patients and families in the future. So if we look at this data of 1,000 people, you'll see 800 of them report having symptoms, and only about 217 will actually visit a physician's office. We also see out of this 1,000 people, less than one will be hospitalized in an academic medical center. So for the people who are hospitalized, we think about what can we do to support their health so that they can be in the outpatient setting. For all the people who report symptoms and aren't seen, what can we do to be a place where they want to come? How can we create access, and how can we be a place that promotes health and wellness and healing? We've talked a lot today about individual health. This is from the RWJ County Health Rankings roadmap at the population health, the applied population health here at UW. And if you look at what contributes to health, clinical care makes up 20% of it. And then 30% is health behaviors. So we've touched on those things today. Other things are what we call the social determinants of health. So 40% is your social and economic factors, things around your education level, employment, safety in your community, and 10% is physical environment. So how can we create the context to support health in our communities? One way is by sharing and collaborating with public health, which is my background, and I'll admit my bias, is approaching things from that perspective. So this definition of public health is from the American Public Health Association, and it's promoting and protecting the health of people and the communities where they live, learn, work, and play. And that really gets at that whole life definition, right? You see someone in your office, and it's a snapshot in time of what's going on for them, and then they leave and return to communities and return to their life. And how do we support and protect their health in those situations? We also have a great definition from Magda Peck, who was the head of the Zilber School of Public Health at UW-Milwaukee, and she defined it as creating conditions for everyone, every day, everywhere to have equal chances and fullest choices to be healthy and thrive and live well and long from generation to generation. And that definition, what stands out to me, is really about equity. How do we contribute to creating things that give everybody an equal chance for health and wellness? So that's a big undertaking, right? That's a big thing to take on. Some ways that we can do that are by working together with public health and primary care. And an example here, this is the social ecological model of health, and it really fits in with what we've talked about today, the whole me and the whole we. And looking at the individual, and individual people make choices about their behavior. They make decisions every day about what they eat and what they do. Those decisions are in the context of interpersonal relationships, their family, people around them, that are also around organizations, so schools, places of worship, religious organizations, other community and neighborhood organizations, the community in which they live. And then we also have public policy that contributes to whether it's easy to make the healthy decision or not. Within our Office of Community Health, we're really looking at our mission as working across areas. So we want to work with clinical care, education, and research. We've already been doing a lot to enhance our curriculum in Madison around community and population health and how we have that longitudinal experience for residents, and also to have a parallel faculty development program so that if this wasn't part of your training or you don't have an MPH, we're all speaking the same language and you can be mentors to residents. On the research side, there are different ways to approach it. On the one hand, we have the research like Nancy Pondy and Rachel Grob talked about earlier, clinical research also, where how do we involve communities in framing the kind of care they want to receive. We can think of it too in the Office of Community Health with how do we evaluate what we're doing. So lots of clinics and lots of individual people here are involved in partnerships and working with community groups. How do we know if what we're doing is working? And through this office, can we enhance how we evaluate so we can continue to improve and make sure we're really improving health? And then in terms of clinical care, things that we're thinking about and looking at down the road are patient and family advisory boards. So how do we get input from patients and communities about the kind of care they want to receive in the clinic? And also things like addressing upstream determinants of health. So one example is the Winger Clinic is piloting a program with the Center for Patient Partnerships. It's called a Patient Navigator program. And if they have a patient who comes up as needing help with transportation or maybe legal issues or housing issues, that they could refer them to someone who can help them navigate those things. So they're not health issues per se, but they obviously impact health. And can we build systems like that in clinical care that are really looking at population and community health? Our collaborators for this office are communities. We want to be engaged with the people we're working with. They are patients, our learners, so our medical students and residents who are teaching. DFM faculty and staff, we want to create resources for those of you who maybe haven't done community work and want to, or maybe you've been doing it for a long time, but there's something else you want to try or new things you want to do. Academic partners, so there are lots of people on campus here and at other institutions that have been doing this work for a long time. We want to draw on their expertise and link up with them and not duplicate services. And then our health system partners. So we have been talking regularly with UW Health Population Health. We've been talking with Unity and payers and thinking about how do they pay for population health so that we can really have the time and resources to address things at this level. So we are a nimble office, I will say, and our plan for the first year is to really partly figure out what's been going on and to continue strengthening our residency and faculty development. So one thing we want to do is do a gap analysis and find out what do you want to know, what do you want to learn about, and what kinds of resources and tools do you need. We also know that community work is going on across the state and has been, and there is a lot of expertise in this department. So we are creating a statewide asset map of community health and community engaged work that's already happening across the state. And over time, what we hope to achieve is to be a hub. So we'd like to connect people to each other. We'd like to connect faculty and staff to patients. And we want to provide consultative support and expertise across all those mission areas. We did a survey in the summer, and it was part of, we've had a HRSA grant, a federal grant for, this is the 5th year, and there were questions about community health that we've been asking for all 5 years, but this year we added the question, what would you want from an Office of Community Health? And the themes that we heard are that people would like to know how to integrate community resources into clinical care. So having a smart set or being able to call patient resources is part of it, but it's not all of it. And there might be more that people need in clinical care for how do you refer patients to the right services that they need. We also want to facilitate community connections. So again, be that hub between communities, patients, other organizations, and our faculty, staff, and learners here. And then this will not come as a surprise to you. People want to know where there's time and funding to do this work. So it's everything from helping to identify grants, like big grants, to maybe having small funds available. If you have a community garden and you need seeds, can we have a program in our department where people can apply to have funding for projects that they want to do? And we're looking at all of those things. Our future work plan beyond this year is really going to depend on what we hear as we're going around and we're doing interviews across the state. We're doing a snowballing interview technique, and as we hear what the themes are and the areas to focus on from all of our stakeholders, that will inform what we do for our work plan for years 2 and 3. Right now, the office is myself and Kirsten Reinflesch. Jennifer Edgoose has time with us as the champion for the Diversity Committee addressing diversity, health equity, and inclusion, and Ann Shensky is providing administrative support. As we identify more funding sources, we will continue to grow. I think there's no limit to the kind of work we could do and the potential for the work, and it'll depend on what comes through with the funding and what areas we choose to focus on. So I think for just a minute or two, I can take a question. Thank you.